I think the good thing, Marcia, is that we're working together, all of us. You are in a good place living. You're in a better place than when you were 4 months ago.
Right.
And you are still doing remarkably well. So even though
Marcia is a lovely woman who moved here a couple months ago from Florida.
I was having panic attacks, so to speak, and I was concerned about the medicine I'd been taking, and I was very nervous about that.
She was getting too many medications where she was living in Florida, and that was starting to affect her memory and her ability to live independently. Prior to a year ago, she was driving, she was very social, she was managing everything on her own, and suddenly her family realized that she was having trouble with literally everything. So they moved her here to California, where her daughter was, and really sought out for her to see a geriatrician. A geriatrician is someone who specializes in the care of older adults.
I never had seen a geriatrician before. In fact, I maybe didn't realize there was such a doctor.
Actually, 50% of people over 80 end up having some of memory trouble, and actually what we would call dementia. Dementia is when your memory starts to affect your everyday life, when you're having trouble with medications and bills and managing your everyday life. So I think some of this is real, meaning that you are having changes in your brain, but I do also think that it's the medications.
Marcia is just one of multiple examples, and I think it's other clinicians that are very well-meaning, but they aren't perhaps trained in taking care of older adults and realizing that the way medications affect older adults is much different, and there's a higher risk of causing harm if we use some classes of medications and some medications in combination, or some medications at really high doses. So she's just, unfortunately, one example of many.
Well, it doesn't matter.
Yeah.
But, they talk about medications, yeah. Well, we trust your judgment.
Yes,
Yeah.
absolutely.
I think that,
The thing about Dr. Parasanotto, and I suppose it's true for all geriatricians, they approach older people, they want to not just manage their symptoms, but actually treat them. So they look at their older patients completely differently.
What questions do you have for me?
You're great.
That's not a question. But I think what's great is that you have the same goal, which is to come off one of these medications.
Yes. I have a lot of faith in her decisions and feel very comfortable with her.
I love the way she spends a lot of time with Mom and really listens to her and really explains things. And she has so much knowledge about medications for older people, and she's fabulous. She's just so good.
Yeah.
What makes me feel good? Just her attitude toward me, and she really kept handy with her hands, typing up everything, and was very interested in me, and I was very happy.
I was thinking, I'm over 60, and my mom sees her at the over 60 clinic. Maybe I can see her also.
The baby boomers are turning 65, and so we're going to have a large number of older adults in need of care by geriatricians.
It's kind of neat to go to an office where all the patients are older. To go somewhere that specializes in your age group is refreshing. That's what good treatment is all about, is having the right doctor.
there aren't enough geriatricians, but we also know from prior reports by the Institute of Medicine is that our current healthcare workforce is not prepared to deal with the older adult population, meaning that we're not trained, there's not enough resources, there's not an understanding of what happens as we age. And so the burden really is on where do we go from here? How do we make sure that older adults are staying safe and independent? And if we don't have enough geriatricians that are really focusing on adults and maintaining their independence, that is ultimately going to lead to more healthcare costs and affect people's quality of life.